Good morning, everybody. Dr. John Willardson here. Here with Memo Hea of Trust Media Group and Trust Implants, and he does all of our digital and our marketing, and is just the man behind the scenes here at Trust Implants. And so, how's your week been, Memo?
It's been good. It's been a solid week. It's weather's getting nice, which is always nice. I feel like, to me, just the weather kind of determines how my week goes, or my day. Yeah. It's good weather, I have a good week. No matter how difficult it is, it's just a good week. So
it's kind of hard here, and especially in Newport, Southern California. We got it good here. It's a beautiful place. Especially, I love this time of year when the hills are green from all the rain, and there's snow on the mountains. And I went for a mountain bike ride on Saturday, and I'm just like, man, this place is incredible. And it's just good to get out and love what we do here, but it's nice to get away and to develop some appreciation,
Yeah, of course. Yeah, it's nice. You know what's funny? I was talking to someone about living down here and how the weather's perfect always, and they asked me, they're like, what do you guys do about the bugs? You probably have so many bugs. But we actually don't.
We don't.
Right?
No.
So it's like great weather and no bugs?
Yeah. I haven't really spent a lot of time in the East Coast or Texas, but apparently from June to October, the bugs are incredible, like insane. I know that in Utah, out kind of because we got a lot of family there, but Utah Lake, which is a huge lake, but anywhere around Utah Lake, the bugs are incredible. There's a lot of bugs out there, and but fortunately, we don't really have that problem here.
Yeah, just nice.
Snakes and skunks. So this week, and just as a little side note here, before we dive into stuff, I was taking my man Stan, our dog, on a walk, and we've just moved from down to San Clemente, and we're in our little neighborhood there, and we have heard stories about skunks, right? And we've heard, you got to be careful of the skunks, and you got to we see them cross the road or run out from underneath a car or something, but I've never thought it would be an issue, right? So I'm taking Stan on a walk, and we're cruising around the neighborhood, and I come around this corner, and all of a sudden there's a skunk sitting on top of this hill, tail up, just blasts both him and me in my face, my mouth, my eye. Stan got blasted in his face. I was like, no way. This was, honestly, I've had so many things happen to me. I've had broken bones and stroke and all kinds of stuff happen. I swear to you, this was probably one of the worst things. It was, it burned my face. It was so bad. I get home and didn't even obviously I didn't go in the house, but I approached the door, and I'm like, hey, Marie, my wife, will you grab me some eye drops? My eye was burning, And she's like, what is that smell? I was 20 feet, 30 feet away from her, and she could smell it from that far away. Oh, my gosh. So then I take, finally, I throw on a bathing suit, and I run him down and try to get him cleaned up in the shower and at the swimming pool. But man, I never realized or never knew that it was that bad. I don't know if you've ever known anybody who's ever been blasted by a skunk, but now I have, and I know how bad it is. But
here's the thing with doctor is anyone that I've ever known that has either gotten blasted by a skunk or bitten by a snake or anything like that is from your family.
That's true.
So that's...
All right,
that's how it is.
That's fair. Yep, yeah. So you're mentioning the snake. My youngest son Seth, he was bit by a rattlesnake.
Yeah,
and that same kind of deal. You hear about it, you're like, oh, because at Loma Linda University, it's one of the largest rattlesnake treatment centers in the country, and there's some of my peers, and when Seth got bit, this was quite a while ago. This is about 2 years ago, but when he got bit, I'd tell him the story, and so he got bit by the rattlesnake, and they think it was an adolescent. So babies, they'll bite, but they don't know how much venom to release, and sometimes they don't get a good bite or grab on. So they can be, but their venom is very concentrated. So they can be dangerous, but adolescents are actually more dangerous, adolescent snakes, because They haven't really bit that many times, as far as in fight or flight response. And also, they too don't know how to regulate their venom. And so it actually bit him twice. So it got him once, and they know that because there was 3 puncture holes. So one fang went in the first time, so he didn't feel like he got a good bite then. So he went in a second time and got him good. But yeah, he was in ICU. It was pretty bad. And during that time, so normally, so a reason I bring up Loma Linda is because one of my peers was mentioning that normally a patient who comes in with a snake bite, rattlesnake, of course, they'll get 5 units or 5 vials of anti-venom. And Seth, I think he got 16 vials. So it was pretty intense, and lots of surgeries and all that. And this was all right before he went off on his mission. So yes, we do have a lot of
stories to tell.
Lots of stories. And I don't know why. The funny thing is right before it happened, I had this impression come over me, like something about a skunk. It was really weird, and I don't have that often, but this time it was very distinct, very clear, and then, kid you not, 30 seconds later, there we go. But so that was my excitement for the week, just getting.
It's a great story to tell.
Experience with the skunk, yeah. So it'll carry on for the next 30 years, this story, and it'll get bigger and better every time I tell it. So. But anyways, all right. Well, thank you guys for watching today. We've got a good live stream for you.
Yeah, I wanted to start first with a few questions from last week's live stream that we had.
Okay, so inquiries or questions from viewers. Yeah,
because we understand that around the time that we do the live streams, not everyone has the time to tune in live.
Right.
So a lot of our viewers just wait for it to go live, and they watch the live stream throughout the week to kind of stay on top of things.
On that note, real quick, so for our live viewers, the time of 9:30 is a relative time. You notice we've got some new microphones, which is really exciting. We're moving up in the world, but it takes us a lot of time sometimes to get set up. So we understand and realize some people do watch live, and if we're on it says 9:30, but that's a pretty that's kind of a relative time. But we know that most people watch us when they can. So
yeah, of course. So in last week's live stream, you had mentioned diet after dental implants. So are there any foods?
Diet?
Yes. The questions, are there any foods a patient needs to avoid? If so, for how long?
So the question would be if immediately after surgery, after the case is completed. So let me just speak to right after the implants are placed. Patients had surgery recently. So that's really the only time that the diet is affected or restricted. And and it depends on the procedure that I've done, number of implants. I mean, just each case it varies, kind of like when we talk about, we don't put everybody in the all-on-4 box. We treat everybody according to their needs. And the diet kind of is the same thing. Yesterday I had a surgery, and we give them a post-operative instruction which has a diet recommendations on there, but it's kind of vague because we give it to the patients who have had all spectrum of procedures. So and her son was really adamant about, I need to know about this diet, and I'm like, she doesn't really have to worry about her diet because of the procedures that I had done on her don't really affect her diet. So whereas others, when I'm pulling teeth out, doing a lot of implants and a lot of surgery, raising a large flap, meaning taking the gum tissue off the bone, those tend to have to monitor their diet a little more. Now, that's post-operative or after surgery. After prosthetic or after the teeth are done and we're finished with the case, there's really no limitation on their diet at all. The only thing they have to really be conscientious of is their maintenance and hygiene, making sure they keep it clean. So you can eat anything you want, but you've got to maintain it after it's done.
Yeah, and then like you were mentioning, every case is different, and we do checkups, obviously, and that's where you kind of let them know, okay, you can, start eating harder foods and stuff like that, right?
Yeah, so we do, absolutely. We check them and see how they're, we've had so many different cases, so many patients, different scenarios, everything I can think of. And if one thing you'll want to, as a patient who's going through the process, and they've committed to the procedure, they're having it done, and you get it done. But when I start to be concerned about their diet is if they're losing a lot of weight. If they're, if it's been a month after surgery and they've lost 10, 20 pounds, now I have to now we have to really change your diet, increase your diet, come off of that post-surgical diet. So right after surgery, it's been a month now, you can get back to a normal diet. And we'll see that infrequently where I have a patient, it's like, man, I've lost, 30, 40 pounds after surgery. But imagine losing all your teeth. It affects you. You have to relearn how to eat. Mm-hmm. And a lot of times it will make them so they don't have much of an appetite and they just kind of stop eating because they can't eat those things that they used to enjoy. For example, if they liked nuts or, broccoli or whatever, or uncooked vegetables, they a lot of times can't eat that until we finish their case. Once the case is completed, teeth are screwed down, locked in, then they can eat anything. So they can get back to that diet. And I'll see the reverse. They'll gain a lot of weight once they get the teeth in, because now it's like, oh man, now they just start eating the things that they really couldn't eat before, and they kind of go overboard because they're like, oh, finally I can eat again. So
that makes sense.
Well, that's a great question, and something that comes up quite a bit,
Yeah. All right. Second question is about mini implants. Because we were talking about that last time you showed some x-rays of mini implants. Mm-hmm. Is the main cause of failure of mini implants due to their size?
Yes, 100%. Well, yes, size, and let me see if I can pull that x-ray up. Size and load factors, again, you go back into the mechanics, but how they were placed, when they were placed, or what was the purpose of them, the final restoration. If we look down here at, let's compare. So here's an x-ray of mini implants. These are the small diameter mini implants. So they've got 3 mini implants here on the lower right-hand side. It's reversed as you look at an x-ray. So versus this tooth right here, right? See how big and substantial the molar tooth is? I mean, if I were to measure this across, it's probably, I don't know, maybe 11 millimeters. So you're taking something that's fairly substantial, and it does the work of a molar. It does its work. When you bite down on your molar, it does its work, right? It'd be very difficult unless the tooth is compromised, had a root canal, has decay or something. If you were to bite down and fracture your molar, it'd be really, really tough. A virgin tooth, meaning it doesn't have any cavities, it's in solid bone, and it's completely natural and healthy tooth. For you to bite down on that tooth and break it would be very, very difficult, right? Mm-hmm. So now let's look at the other side. So they're trying to replace, and this goes into the world of implants, right? They're trying to replace this tooth here with some form of prosthesis, whether it's implant's the only medium we have to support a artificial tooth that mimics a regular tooth, right? Because if we have partials and bridges and that sort of thing, but an implant where there's a tooth missing, we have nothing to connect to, we have to put something in the bone and it supports that tooth, right? So they've got 3 implants here to support essentially the diameter, 2 to support this one tooth, and even there, it's not sufficient. Anyways, long story short, the load factors here versus here and what the tooth and what that area can handle are very different. Very difficult to break or fracture this tooth. Very easy to fracture these because you have a little, these are about 2 millimeters maybe in diameter. And one, like if it's this much of that implant is sticking out. So and then you have a tooth that's this big, right, on a tiny little, I guess a little nail. And so if they bite wrong one way or the other, it'll snap off. And that's exactly what happened up here. So it's kind of a long answer to a very simple question, but they're too small versus a standard implant.
Well, that's good because, if you would just say yes, then we'd move on. But you're showing the X-ray, and just by looking at it, it shows that, yeah, it makes sense. I mean, you look at the teeth right here,
yeah,
and then you compare the mini implants, like it's just, or even the thin implants here on the bottom left.
Right. So,
X-ray.
Yeah, I mean, and that's why I like to show these things, because we're not there's no magic. There's no magic treatment. There's no that makes it happen faster, or once we lose our teeth, it's a major thing. Now the question is, how are you going to have them restored? And because there's so many different modalities out there, mini implants, all on 4, and there's so much noise in the marketplace on TikTok and YouTube, and I mean, I can go on YouTube right now. I won't do it, but I could pull up something on YouTube that will convince you, and possibly me, probably not me, but that mini implants are the way to go. Yeah. I guarantee you I can find a video on YouTube that will convince the world that mini implants, there's no question about it. I mean, we've shown the TikToker that takes her dentures in and out, and she's just promoting and pushing mini dental implants like crazy. So that's why I caution patients. You don't want to go to Dr. Google or Dr. YouTube to find your treatment for you specifically, because they don't know, or you don't, and a lot of times a patient doesn't know really what's best for them and what is the most ideal for long-term success. This patient somehow was convinced, because he paid money for it, this was the way to go, that these mini implants were going to last me. They're less expensive, less downtime. The reason that they even use these is because a general dentist who has pretty much not a lot of surgical skills or surgical background, they don't even have to make an incision. They just drill right in through the gum, give local, of course, drill right through the gum tissue and put the screw in. It's that simple. I mean, anybody could do it. And that's the reason that there's the Shatkin mini implant group. That's the reason they push it, is to get it in the hands of general dentists that, they know that they don't have the surgical background and can do these fairly easily. And it's quick,
easy, and it's cheap for the patient. So
exactly.
Yeah, if you
kind of solves the problem, but in the end, if he spent $10,000, $15,000, $20,000, that money was wasted, because it's going to cost him more money, because I got to go retrieve those fractured implants. I got to take the other ones out. Yeah, so you can end up spending and wasting a lot of money.
Yeah, as we talk about here quite a bit. So thank you. Number 3 is, we had mentioned last week about materials and how titanium is preferred. Are there any risks with titanium?
A very, very low percentage, about maybe 1% of the population has a titanium allergy. So, but if you can mitigate your risk by making sure that the doctor who's using, or that you've selected for your treatment, is using a high quality, commercially pure grade 4 titanium implant. Implant comes in, and we've said this in different streams, but titanium comes in 4 grades, 1, 2, 3. Actually, it's 5, but 5 is very, very, it's an alloy. So 1 is really soft. 2 is the next level of hardness. It's still too soft. 3 is still too soft. 4 is the hardest of the grade 4 or of the commercially pure titanium. And then you get into grade 5, which is an alloy. But when you get into the alloys, you're mixing other metals. So if patients have, and usually the metals that are mixed, it's not an issue. Patients for the most part handle them just fine. But I like to eliminate any factors from variable factors that might affect my overall treatment, because you just never know, and we can't really get into getting the information on what potential allergies might this cause the patient. I know that I'm going to cause very low chance or risk of allergy on using commercially pure titanium implants. So for me, I like to cut out as many variables as I can because it's going to increase my success rate. It's going to increase the longevity and the potential for problems down the road. So.
Yeah. Okay. Awesome. Thank you.
Yeah.
Those were the 3 questions. So now let's move on to the case of the week.
All right. So I mean, I can go on and on about this stuff, but this was actually a surgery that, in fact, I'd like to talk about. Well, you know what? Before I go into that, before we go into the case of the week, did you see that Andrew Huberman this week came out and he posted a YouTube video regarding oral health and its role in brain and body health?
I haven't seen it, but you mentioned it this morning, and now I'm excited to watch it because it's literally what we talk about here.
It absolutely is. And I've been saying this for 22 years or more, that it's the beginning of our entire system, right? It's the beginning of our digestive system. Our mouth is the beginning of our digestive system. And so I want to take a look at this case of the week or before and talk about, imagine if this was somewhere else in the body. Like, we would be rushing to the doctor, to, whoever could treat this, we would be rushing there to get it taken care of. So, anyways, just as a quick summary, Andrew Huberman has the 6 pillars of optimal health, which is sleep, exercise, diet. I forget all the pillars. Mental. Oh, you have them?
I got them right here. So number 1 is sleep. Number 2 is sunlight exposure, or just being outside, but then also being in the dark is what he talks about, like both. Nutrition is number 3. Exercise number 4. Stress management number 5. Relationships and social engagement number 6. And then in this video, he's been talking about these 6 pillars
for a long time,
for years.
Yeah.
And in this video, he's like, I'm adding an extra one to this pillar. The 7 pillars, he calls them of like better
optimal health,
optimal mental health, physical health, and then performance, just overall.
So if you're not familiar with Andrew Huberman, I mean, this guy, he's helped me tremendously. I mean, I would venture to say has changed my life when I apply what he promotes, right? I mean, I wouldn't say lazy, but I get very distracted easily. So if I could, and if all of us could apply what Andrew Huberman promotes, and even just 20, 30, 40%, our lives would drastically improve if we could just increase, and he comes at it. He's a PhD in neuro-ophthalmology and neurology, so at Stanford University. So the guy is very, very obviously well-trained and is now, thank goodness, grateful for YouTube and for the technologies that we have, because we can gather so much good information,
Yeah.
And so anyways, so what you were mentioning, the 6 pillars, now he's added the 7th pillar, which is optimal oral and gut health. So which leads me, we'll watch this video if you can. It's how to improve oral health and its critical role in brain and body health. So we won't waste or spend a lot of time on it. I've watched the majority of it, and it's really, really good stuff. So now we'll go to the case of the week. So this was my surgery on Tuesday. And just from a layman's perspective, what is it that you see here? If you were to see this, I don't know, do you see anything that stands out?
What that tongue look? First of all, that mouth looks like it went through hell and back, or just they put whatever they could find in there.
Right. And so you mentioned the tongue, right?
Yes.
And you see all this white plaque here. I mean, so that's candida, and it's the body chronically trying to fight off what's happening here in the mouth. And if her teeth, or his teeth actually, were not there, or if they were clean, we would not be seeing all of this, we'll call it activity or motility. Motility is just this movement of cells and action, and the body is just in motility mode. It is trying to fight off everything that's happening here. It's kind of like if many years ago, about 6-7 years ago, our neighbor down the street, their house caught on fire, and we talk about the stories. And of course, my son was part of the process of how this house caught on fire. They were fixing the dings in their surfboards in the garage of our good friends around the corner from us, and they had the resin. They left it out, and so somehow, I don't know if it was the water heater or whatever, they were in their garage shaping and fixing their surfboards, left the resin out. I get a call at about 12:30 at night. Hey, John, could you could you come over? I need to borrow some pants and a shirt. I'm like, what in the heck is going on? Is my buddy Steve Wynn. Sure enough, their house is engulfed in flames. The roof is on fire. It's blowing like, shrapnel in the air. It's like, so we come around. Of course, I bring him his pants and his shirt because he was literally out in his flip-flops and his underwear because they could not grab anything, nothing. They couldn't grab anything from their drawers. I mean, think about that.
Yeah.
It's just, I see this as a similar scenario. It is a fire that is raging, and it's affecting everything around them. I mean, that's how I see it, right? I see inflammation of the gum tissue. These teeth are just angry. They're like, the tissues are angry. The bone is receding. There's a lot of acidity, candida. I mean, there's so much going on, and eventually what we had to do is get all these teeth out. And then all of a sudden the motility when I liken it to the wildfire, it's like there's just so much action and movement going on. And until you put that fire out, then things can settle down. And the body likes that latent, it doesn't want a whole lot of motility. It doesn't want a whole lot of, things, having to fight off infections and calling in the troops to kind of fight off all the stuff that's going on here. So, and once you remove those teeth, put the fire out, all of a sudden the color of that tongue I guarantee you when I see him next week, because this was on Tuesday, I'll see him as a follow-up on next week. I've extracted all the teeth. I've put the fire out. The fire is totally out. His tongue will be a completely different color when I see him on next week. So anyways, I just wanted to look at these scenarios because this is one, and we see this all the time. Same thing here. Fire is raging. Tissues are raging, inflamed. Teeth are loose and mobile. There's just so much going on here, and the body is just screaming like, help, get this out, fix this, brush your teeth, do something, right? And so I love that Andrew Huberman is bringing this to light, because imagine if you were to find something like this deep in your gut or on your pancreas or on your brain, which would be equivalent of a brain tumor, pancreatic tumor. It's the same activity, the same acidity level of a tumor. That's what this is. But this is a tumor that that's kind of driven by their lack of, I guess, hygiene and not caring. But oftentimes tumors will develop for the same reasons. If you develop, extreme diabetes, and then you get pancreatitis, and then you get a pancreatic cancer, so on and so forth. My father died of pancreatic cancer years ago, and it's a very subtle, quiet disease, and you don't know until it's too late. And that most likely, he was, I wouldn't say the epitome of health, but he wasn't that unhealthy guy, but he wasn't it was years ago. So it was before all the kale and all that stuff, So, but sugar, I don't know if growing up, if you had a high sugar diet.
I actually didn't.
You didn't?
No.
So your parents were smart in that sense.
My mom was very strict with that. And I actually give her credit now because I don't
You don't crave it.
I don't crave it as much, like I'll eat it, but yeah, it's just I control it very well, and that's how all my siblings are. So
yeah,
my parents did a good job,
which is good. I mean, for us, it was Saturday morning, wake up and you have 3 bowls of the most sugary cereal you can find, right? And everything was soft drinks and fast food. I mean, I swear to you, in college, for 4 years, I ate fast food every single day. It was just like, but back in the 90s, that was just what you did. We didn't have all the information that we do now. But anyway, so we look at this again. Fire is raging, and it has to be addressed. And now Andrew Huberman is bringing this up because I go back to, if you were to see this somewhere else in the body, I mean, unfortunately, you can't really see deep inside, but if this was happening somewhere else in the body, physicians and doctors would jump on that you would not let this continue to rage. This has been raging and brewing in this patient's mouth for 15, 20 years, just sitting there, just, constantly brewing like this. So the fact that we're putting a light on something that truly does affect our overall health, we see it here every single day, because when I take a case like this or like this, what is this here? That's a pyogenic granuloma. So that is a pus pocket infection that is part of the body, and the body is so incredibly smart that it calls in the troops, it calls in the fire department to try to put this fire out. The only thing the body can do is call in, the lymphocytes and the different cells to help. The only thing it knows how to do is call those in to try to eliminate the infection. But this is as good as they can do until the cause of infection is removed, which is removing the teeth. So this is just a large pustule granuloma of tissue and filled with pus, calculus, different that comes out with when the teeth come out. So again, fire is raging, and has to be addressed. So, but now, so we look at this patient here, and this is his after photo. So after the fire is out, now everything is settled in, and the change and we go back to Andrew Huberman, the change of the guy that this photo was taken of to this photo, two completely different individuals, and much healthier and more at kind of neutral position in this state here.
Yeah, of course. Well, going along with the case of the week, we talk about the procedures, right? All on 6, all on X, and what's best for the patient. Same with, the materials that we use. And we've talked a little bit about this, which is the psychological part of things.
Yeah.
But that is talking to the patient yesterday, actually, the one that got surgery, because we've become friends with, the whole family. So she was just telling me how, number one, she was excited to be able to eat whatever she wanted, right? But I was also mentioning her that she doesn't realize it now, but just everything else, like the psychological that comes from it, like just being able to smile and people notice their smile, and how, a few years from now, she's not even going to remember what it was like.
Right. Yeah.
And so I wanted to discuss that with you, because, you've been doing this for 20, 25 years. So you've seen thousands of patients come in and out. And, we wanted to talk about like the emotional changes that you've seen in those patients.
Yeah. So again, I go back to Andrew Huberman, and I love that he's bringing this up, because he's not just talking from a health standpoint or you're going to sleep better, or you're going to, be able to run longer or whatever. But it's the psychological health that comes along with this, because you can imagine when, you have a case where a patient comes in such as this, same kind of scenario. Obviously every case is different, but actually a lot of them are very similar. Let's see, did I not grab that? Anyway, so the, and then ends up with post-operative or after treatment photos such as this. The difference between this guy kind of just, I don't know, I wouldn't say struggling, but just kind of just getting along, not being proactive, and not just, once he made the decision to get this problem resolved, he took action, he was proactive, and he made the choice. Now he's on the journey to here. This guy and this guy are two totally different people now.
Yeah.
They really are. And if you were to talk to him, he would tell you that. And I have actually testimonials of him saying that, once we were done with the case, and it's a journey, it doesn't happen in 24 hours like they say on some of these other videos, but once they're completed, case is done, teeth are in, they're at dinner with their wife or whatever, it's a total game changer. I mean, there's not a lot of things you can have done to your body, even if you have a facelift or eye lift or blepharoplasty or whatever cosmetic procedure you can have done, that patients will benefit as much as they would this.
Oh, yeah, for sure. And I mean, you showed a pretty good picture, because a lot of the times they give us half a smile, or even like
exactly right
now, knowing this, when you meet someone and they don't even have to like fully show their teeth to know that there's something going on there, because they'll just either hide the smile or like give you kind of half of a smile, and they're just holding themselves back from who they really are, right?
Yeah.
Like they can't laugh like they used to, or like be in an environment. And something else that I see a lot, because I work with, the marketing side of things. So I see what patients request and what they're asking. And so many times is, I want a new job, but my smile is holding me back. Or, I want to, go to their kids' parent-teacher conference, and be able to like be confident in front of their kids, and just kids' games. They're just being held back from just being their true selves in so many aspects of their life.
Yeah, that is so true. In fact, when they're in this state, because I'm not like picking on this before photo, but when they're in this scenario, in this situation, they've grown accustomed to, over the years, just accepting this as their fate. Like, okay, it is what it is. I'm wearing dentures or partials. I'm losing teeth, or accepting this as, this screams to me just giving up at a certain point. Because actually, if we look at the teeth themselves, they're not horrible. I mean, now that there's completely bombarded with calculus and tartar and plaque and debris, but the teeth themselves are actually okay. It's just giving up to the point of not brushing at all ever, and not even trying to even just rinse your mouth out. And so it's a matter of just completely kind of giving up, but that's a mental thing, right? It's not, I mean, if you've ever had times where you felt totally overwhelmed and you're just like, man, I give up, But, and that's really kind of what's happening here. And once restored, this is actually this case here. Once restored, now the hopelessness is gone. And that's where that light comes back in. You talk about frequencies. Once that hope is restored, if you've ever, all of us have had scenarios where you felt that glimmer of hope, like, oh yeah, we're going to get through this, or we're going to make it through whatever scenario. And you feel that glimmer of hope. Now you're more energized, more ambitious, more motivated. You can dig a little bit deeper to, keep up that good fight. But when you're in a state where you're just like so hopeless, like, man, I don't even know where to go. I don't know where to turn. I don't know what to do. I don't, and getting on the path of the restoration and restoring not just their mouth, their teeth, and their smile, but their overall appearance and confidence. Once you jump on that path with somebody, you're kind of committed, because they're going to take you down a path wherever they may lead you, which oftentimes can, end up, with situations, like this. This guy jumped on that path with the doctor, right? Mm-hmm. Thinking, you know what, let's fix this. Let's go. Come on, let's do it. But he got on the wrong trajectory. He got on the wrong path with the wrong person. So in the end, it kind of drove him many steps backwards, because there weren't. And I only saw this patient as a consult. I don't know who did the work. It's not about that. It's just once you decide who the doctor you're going to go with, the materials, and that's why we emphasize so much here on all of the things we talk about. Once you jump on that path with that person, they're going to take you to where they think and know, or they think that you should end up. Mm-hmm. And that can vary. We'll have comments on our channel or on our social media. My doctor says this, or I feel like this is the best way to go. Or you see all these ads for different types of implant treatments or oral reconstructive treatments. So we don't really know, even within a corporate center, because now you're going to taper that down into just the doctor himself, and he's going to make those choices. Actually, he's driven by the numbers and the money of the corporate center, so he's going to do all on four. Anyway, so it's important to get on the trajectory with the right, the right practice, people, so you can end up with results that, that can help you to achieve those goals that you have.
And that will last a lifetime, right?
Yeah.
Because sometimes, you can get the all on four, or you can go to someone who knows kind of what they're doing. But, we see it here all the time where 5-6 years later, plenty of prosthesis later, and implants everywhere. They just come to you because they can't find anyone else. They can do the work. But I imagine what you do is very satisfying. From my point of view, it seems like it is satisfying because you build those good relationships with these patients, and a lot of them years later come back. They bring treats. Mm-hmm. They treat the office nice, and
that's the way that's how it has to be, right? This is of course, we love what we do here, but by the same token, when we do something, we want it to be a good investment for the patient that's going to last them. And so that when we do see them, it's, just, hey, everything looks great and you're good. And then, so let's see here.
Okay. So, that was the case of the week. And then just focusing in again, that psychological side of just dental implants, talking about how, it really changed someone's life in so many ways. We talked about Dr. Huberman, your gut, how you digest, what you can eat, but then also your confidence. And that's, again, it's something that we all have, is our appearance is what builds our confidence, right? And if there's something that's off, right, that's what kind of can cause our confidence to be shaking a little bit. So now I wanted to go over a few viral TikTok videos, if there's any viral ones, but if not, I think we can continue talking about Dr. Huberman's video, because I haven't watched it at all, but you said you've watched parts of it.
I've watched the majority of it, and basically, and we can just kind of go a little bit through, he talks about the biology. So you've got the tooth itself. So the tooth can be damaged, whether it's cavities and need root canals, crowns, fillings, whatever. So that's, and then you've got the soft tissue, the gums, the bone, the saliva, and there's factors in each of. Saliva is critically important. When patients who are diabetic or on certain medications, and their oral health could be just fine, but they may get on a medication that causes dry mouth. Mm-hmm. The medical term for that would be xerostomia, so your mouth is very dry. And the saliva acts as it helps increase the motility and that movement of cells, the movement of the activity that's happening in the mouth. A saliva that's for a patient who is on a medication, or if their mouth is dry, the motility slows down dramatically, right? So once that motility slows down, then all that bacteria just kind of harbors and just sits there, and the saliva is very viscous. It's very kind of thick, and so lots of variables and factors. Saliva alone, if a patient goes from a severe, from dry mouth, let's say they started a certain medication. SSRIs can cause dry mouth. SSRIs are like psychotic meds. So a lot of patients will get put on Celebrex or anyway, there's a lot of different types of psychotic meds that patients will take just to help their mood, like Prozac, for example, is a very common one. So, and they definitely cause dry mouth, but some of them cause severe dry mouth. And so I could see a patient go on those, and within 6 months, a fire will be raging in their mouth. So it happens really fast, is my point. It's not a slower process. Once you remove the saliva or you affect the saliva, that one little thing will dramatically increase the kind of the breakdown of the mouth, and the teeth. So, and he, it's good because he goes into, a lot of things, tooth remineralization, which is, he talks about we are in constant flux of demineralization and remineralization. So our bones, for example, we're in a constant state of demineralization and remineralization. When an astronaut goes into space, if they don't exercise, they will come home with osteoporosis because there's no force, there's no pressure, there's no load on the bones. And so they come home because the remineralization process has been kind of slowed down dramatically because we need that force, we need that pressure. That's why exercise is critically important. Just the gravity of walking and work, helps our bones to be in a state of homeostasis, meaning it's in balance. And so, again, that's one tiny little factor that is critically important. And he doesn't go into, of course, the mechanics and how the mouth works and the biomechanics and what happens when you lose one tooth, what happens when you lose a quadrant of teeth or when you lose all of your teeth. That's where we can come in.
Yeah.
Because that's exactly what we talk about. And the mechanics is as important. That's why I was bringing up the saliva. Saliva is critically important. Mechanics is as important as saliva. I can have the same thing. I can have a patient that's lost a quadrant of teeth. In a very short amount of time, they'll start having issues everywhere else because of the mechanics and the load and how they're chewing now only in one spot. And you continually just chew in that one spot over and over, and then you start to grind in that one spot, and the teeth start to break down. So
awesome. Yeah, I'm excited to watch it and take notes because it's something we talked about right before the stream is we are going to do some sort of like collaboration with this video where we'll talk about it. We might do like little short segments, but I think it's very interesting. He's got a huge following. I've been following for so long, and like you said, I've applied a few of the things that he talks about, and it's all research that he's done. Yeah, good thing he's back.
He can back it up. Yeah,
yeah, and they're constantly doing new research for like just brain health and like physical health and all that. So I'm excited to watch it and then kind of review what he has to say about oral health. But that's what we have for today, Dr. Willerson. Yeah. If you guys have any questions or would like to send Dr. Willerson your x-rays so that he can do like a video consult or just review your case, feel free to do that at info@trustimplants.com, which is our email.
Yeah. Yeah, and we appreciate all of our viewers. Again, I say it's no one really cares about this stuff until they do. And we're talking about minutia that most of the world doesn't really care much about. But once you have these issues, once you have these sort of problems or complications or whatever, and you end up in a situation like this, then it's critically important what we're talking about, the things that we talk about, the stuff we pull from the internet or from social media or YouTube. We are going to target these things so that we can help our viewers and as our, hopefully we'll continue to grow our audience and we can be a source of good for those out there. So anyways, I'm Dr. John Willardson. Thank you guys for watching, and we will be back next week. So tune in next week for the live stream from Trust Implants. Again, Dr. John Willardson with Memohea, and we'll see you all next week. Have a great week.